Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Barium enema. Introduction. A barium enema is a test that helps your healthcare provider look at the colon. The colon is also known as the large intestine. Healthcare providers may recommend a barium enema to help diagnose problems in the colon. If your healthcare provider recommends a barium enema, the decision whether or not to have this procedure is also yours. This program will help you understand better the benefits and risks of a barium enema. Anatomy. The food you swallow first goes to the esophagus, then down to the stomach. Then it proceeds to the small intestine. From there it goes to the large intestine, or colon, before being excreted. A barium enema test helps detect abnormalities in the colon. These include tumors and polyps. On the left you can see an example of a normal colon. On the right, you can see polyps in the colon. Procedure. This procedure is usually done on an outpatient basis. This means you will be able to go home a few hours after the test. The aim of the procedure is to place barium in the colon so that X-rays can show the colon more clearly. The barium is placed using an enema. Since barium is a substance that shows on X-rays, abnormalities in the colon show up better when it is used. Multiple X-rays need to be done to follow the barium in the colon. The test may take up to a few hours depending on how fast the barium goes through. A barium enema is usually not painful, but it may be uncomfortable. You may feel the urge to go to the bathroom. After the first set of X-rays, you may be asked to go to the bathroom and empty some of the barium. More X-rays may be taken. The radiologist may also place air in the colon and take more pictures. Once the radiologist is satisfied with the pictures, the test ends. The barium will be excreted in the feces like any other food material. After the test, you may not be able to drive yourself, so it is important to have somebody drive you home.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risks and complications. This procedure is safe, but there are some possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. X-rays are used during this procedure. The amount of radiation during this test is safe, but this same amount could be dangerous for unborn children. It is important to make sure you are not pregnant before a barium enema. In the rare instance of an already present perforation, or a hole or tear in the colon, the barium may leak around the bowels. This could cause a severe inflammatory response that could potentially be fatal. Rarely, the procedure itself could cause a perforation of the colon. Patients who already have perforations in the bowels are not given barium enemas. Some people may not tolerate barium well. It may upset your stomach. Rarely, patients may have an allergic reaction to the latex in the tube used to administer the barium.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A barium enema is a test that helps your healthcare provider look at the colon. The colon is also known as the large intestine. A barium enema can be helpful in detecting problems in the colon. The aim of the procedure is to place barium in the colon so that X-rays can show the colon more clearly. The test helps detect abnormalities in the colon, such as tumors and polyps. The barium is placed using an enema. Multiple X-rays need to be done to follow the barium in the colon. The test may take up to a few hours depending on how fast the barium goes through. After the first set of X-rays, you may be asked to go to the bathroom and empty some of the barium. More X-rays may then be taken. The radiologist may also place air in the colon and take more pictures. The barium enema test is safe. Risks and complications are rare. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.